What are the key characteristics of Down syndrome and how do they relate to the underlying genetic mechanism involved? Answer. Down syndrome, also known as trisomy 21, is characterized by a combination of physical and intellectual disabilities. The underlying genetic mechanism involves the presence of an extra copy of chromosome 21. This can occur due to non-disjunction during meiosis, resulting in a total of 3 copies instead of the normal 2. Key characteristics: physical features: hypotonia, distinct facial features, slanted eyes, flat nasal bridge, single palmar crease, and short stature. Cognitive impact: varying degrees of intellectual disability, typically mild to moderate. Associated health issues: congenital heart defects, gastrointestinal anomalies, and increased risk of leukemia and Alzheimer's disease later in life. Understanding these characteristics helps in early diagnosis and management. Genetic counseling is essential for families to understand the implications of the condition, including the inheritance patterns. Most cases are sporadic and the risks in future pregnancies. Mr. Smith is concerned about his family history of Turner syndrome, particularly regarding his daughter who is exhibiting signs of delayed growth and development. What should be Mr. Smith's next steps regarding genetic counseling and testing? Answer. Mr. Smith should seek genetic counseling for his daughter, as Turner syndrome is a chromosomal condition that affects females, are characterized by the complete or partial absence of one of the X chromosomes. The counselor can guide him through the following steps. Family history assessment. Gather detailed information about any family history of Turner syndrome or related conditions to understand genetic risks. Physical examination. A healthcare provider should conduct a thorough examination of his daughter, looking for typical signs of Turner syndrome such as short stature, webbed neck, and cardiac anomalies. Genetic testing. Recommend karyotype analysis, chromosomal analysis to confirm the diagnosis. This involves obtaining a blood sample to examine the chromosomes for the presence of one X chromosome. Discuss implications. Review the implications of a potential diagnosis, including the management of associated conditions like heart defects, kidney issues, and hormonal treatments for growth and puberty. Genetic counseling can help Mr. Smith make informed decisions and prepare for potential medical and educational needs for his daughter. Describe the major inborn errors of metabolism and their implications for pediatric care. Answer. Inborn errors of metabolism are a group of genetic disorders that affect metabolic processes in the body, leading to the accumulation of toxic substances or the deficiency of essential compounds. Key examples include phenylketonuria PQ, a deficiency in the enzyme phenylalanine hydroxylase, leading to elevated levels of phenylalanine, which can cause intellectual disability. Early dietary intervention, low phenylalanine diet, can prevent these outcomes. Maple syrup urine disease (MSUD), caused by a deficiency in branched-chain alpha-keto acid dehydrogenase, resulting in the accumulation of branched-chain amino acids. Affected infants may present with lethargy and feeding difficulties. Management involves a specialized diet restricting these amino acids. Galactosemia, a disorder resulting from the inability to metabolize galactose, leading to liver damage, cataracts, and intellectual disability. Early detection through newborn screening and immediate dietary changes, removal of lactose and galactose are critical. Pediatric care requires early identification through newborn screening, dietary management, and regular monitoring for growth and development, emphasizing the importance of genetic counseling for affected families. What role does carrier testing and genetic counseling play in the management of congenital malformations? Answer. Carrier testing and genetic counseling are vital components in the management of congenital malformations. They serve to identify risks. Carrier testing can identify individuals who carry genes for specific inherited conditions, allowing for assessment of the risk to offspring. Informed decision-making. Counseling provides parents with information regarding the implications of being a carrier, the likelihood of having affected children, and reproductive options, including prenatal testing. Guidance on screening. Couples can receive recommendations for prenatal screening options, such as non-invasive prenatal testing or invasive tests like amniocentesis and chorionic villus sampling that can help identify congenital malformations early in pregnancy. Support and resources. Genetic counselors provide emotional support and resources for families navigating complex decisions about prenatal testing and potential outcomes. Educational role. They educate parents about congenital malformations, the significance of family history, and available preventive measures. Genetic counseling fosters a proactive approach to managing risks associated with congenital malformations, ensuring families have the support needed for informed choices. How can prenatal genetic screening tests, such as non-invasive prenatal testing (NIPT), impact clinical decision-making during pregnancy? Answer. Prenatal genetic screening tests, particularly NIPT, play a crucial role in clinical decision-making during pregnancy by providing risk assessments for chromosomal abnormalities such as Down syndrome, trisomy 18, and trisomy 13. Early detection. NIPT, which analyzes fetal DNA circulating in the mother's blood, can identify potential risks as early as 10 weeks of gestation, allowing for timely decision-making. Risk stratification. Results can stratify risk, guiding further diagnostic testing like amniocentesis for women at higher risk based on age, family history, or previous pregnancies. Informed choices. Positive results may lead to discussions about pregnancy management options, including preparation for special needs, potential termination, or further testing. Reduced anxiety. By providing more accurate risk assessments, NIPT can alleviate anxiety for expectant parents compared to traditional screening methods, enabling more informed parental decisions. Resource allocation. Results may influence referrals to specialists, prenatal care planning, and resource allocation, ensuring that families receive the appropriate support and medical interventions as needed. Explain the significance of understanding congenital heart disease (CHD) in pediatric practice. Answer. Understanding congenital heart disease (CHD) is essential in pediatric practice due to its high prevalence and impact on long-term health outcomes. Prevalence and identification. CHD is one of the most common congenital anomalies, affecting approximately 1 in 100 live births. Early identification through prenatal screening and postnatal assessment, e.g. echocardiography, is crucial for timely intervention. Management strategies. Pediatric practitioners must be familiar with various types of CHD, e.g. ventricular septal defect, tetralogy of Fowler, and their management protocols, including surgical options and medical therapies. Multidisciplinary care. Effective management often requires a multidisciplinary approach involving pediatric cardiologists, surgeons, nurses, and social workers to provide comprehensive care, addressing both medical and psychosocial needs. Long-term monitoring. Many children with CHD require lifelong follow-up due to potential complications such as arrhythmias or heart failure. Family support and counseling. Practitioners must be equipped to offer support and education to families navigating the complexities of CHD, including potential impacts on development, exercise recommendations, and psychosocial support. What are the implications of limb deformities in pediatric patients, and how should they be managed? Answer. Limb deformities, such as clubfoot or congenital limb deficiency, can significantly impact a child's functional ability and psychosocial development. Management involves early diagnosis. Prompt identification through physical examination and imaging, if necessary, is crucial for planning effective interventions. Multidisciplinary approach. Management typically involves pediatricians, orthopedic surgeons, physical therapists, and occupational therapists to address medical, functional, and psychosocial aspects. Non-surgical interventions. Many conditions, such as clubfoot, may be initially managed with non-surgical methods, e.g. the Ponseti method, which involves manipulation and casting. Surgical options. If conservative treatments fail or for more severe deformities, surgical intervention may be required to improve function and appearance. Rehabilitation and support. Post-treatment, ongoing physical therapy is often necessary to enhance mobility and strength. Family education and support are also critical to help children adapt to their condition. The implications of limb deformities highlight the importance of a comprehensive, patient-centered approach that focuses on improving quality of life and functional outcomes. Discuss the importance of prenatal screening for neural tube defects and the available testing options. Answer. Prenatal screening for neural tube defects (NTDS) is vital for early detection and management of conditions like spina bifida and anencephaly. Key aspects include epidemiology and risks. NTDS occur when the neural tube fails to close properly during early embryonic development, with incidence affected by factors such as maternal folic acid intake, family history, and certain medications. Screening methods. Maternal serum alpha-fetoprotein (MSAF). Elevated levels of alpha-fetoprotein in the mother's blood can indicate an increased risk of NTDS, prompting further investigation. Ultrasound. A detailed ultrasound can be performed to visualize the spine and detect any abnormalities associated with ETD. Folic acid supplementation. Counseling regarding folic acid supplementation before conception and during early pregnancy is crucial in reducing the risk of NTDS. Genetic counseling. Families with a history of NTDS should be referred for genetic counseling to discuss risks and options for future pregnancies. Management of diagnosed cases. If an NTD is diagnosed, a multidisciplinary approach is essential for planning management strategies, including surgical intervention postnatally and ongoing care. Prenatal screening for NTDs underscores the importance of proactive maternal health measures and timely interventions to enhance outcomes for affected infants. What are the guidelines for managing patients with congenital malformations? Answer: guidelines for managing patients with congenital malformations focus on early detection, comprehensive assessment, and individualized care plans. Key components include early diagnosis and screening, utilize prenatal screening e.g. ultrasound, maternal serum screening, and newborn screening to identify congenital malformations early. Multidisciplinary care teams collaborate with specialists e.g. pediatric surgeons, geneticists, cardiologists to address complex medical needs and formulate comprehensive care plans. Family support and education provide families with resources and education about the specific congenital malformation, potential impacts on development, and available interventions. Regular monitoring and follow-up. Establish a schedule for ongoing assessments to monitor growth, development, and any associated complications, adapting management plans as needed. Psychosocial considerations address the psychological impact of congenital malformations on both the child and family, offering counseling and support services as necessary. In what ways can genetics and dysmorphology influence the clinical approach to pediatric patients? Answer: genetics and dysmorphology significantly influence clinical approaches in pediatric patients by personalized diagnosis. Understanding the genetic basis of congenital anomalies enables accurate diagnosis and the potential identification of syndromic associations, guiding management. Targeted interventions. Knowledge of specific genetic conditions allows for tailored interventions, such as early surgical correction in cases of congenital malformations or specific therapies for genetic syndromes. Preventive care strategies. Genetic insights help identify at-risk populations and inform preventive measures, including carrier testing and counseling for families with a history of genetic conditions. Research and development. Advances in genetics promote the development of new treatments and interventions for genetic disorders, improving overall pediatric care. Holistic family impact. Genetic and dysmorphological considerations extend beyond the individual patient, requiring comprehensive family support and education regarding potential hereditary implications. What is the significance of head circumference measurement in infants, and how is it used to assess neurological development? Answer: head circumference measurement is a critical part of pediatric assessments, particularly in infants, as it serves as an indirect indicator of brain growth and neurological development. The brain undergoes significant growth during the first 2 years of life, with most of its growth occurring in the first year. Tracking head circumference allows healthcare providers to identify potential abnormalities early. A head circumference that is significantly below the expected range may indicate microcephaly, which can be associated with genetic disorders, developmental delays, or congenital infections. Conversely, macrocephaly may signal conditions such as hydrocephalus or increased intracranial pressure. Regularly measuring head circumference at well-child visits helps identify deviations from expected growth patterns and allows for timely intervention. The American Academy of Pediatrics OP guidelines recommend measuring head circumference at each well-child visit until the child is 2 years old, as this can help ensure that any issues related to neurological development are addressed promptly. Which vaccines are recommended at 12 months of age, and why is the timing of these vaccines critical for immunity? Answer: 12 months. Several vaccines are recommended to ensure children are protected against serious infectious diseases. The measles, mumps, and rubella vaccine is crucial, as measles outbreaks can have severe complications, including encephalitis and pneumonia. The varicella vaccine, which protects against chickenpox, is also recommended, as this illness can lead to secondary infections and hospitalization. Additionally, the hepatitis vaccine is introduced to prevent liver disease caused by the hepatitis virus. The pneumococcal conjugate vaccine, PCV, protects against pneumococcal infections, which can result in meningitis and pneumonia. Timing is critical because maternal antibodies can interfere with the immune response if these vaccines are administered too early. The CDC recommends these vaccines at 1 to 1.5 months to optimize immunity while minimizing the risk of disease exposure. Delaying these vaccines can leave children vulnerable to vaccine-preventable diseases during a time when they are at higher risk due to social interactions and exposure. Mrs. Parker brings her 6-year-old son, James, to the clinic because he has been gaining weight rapidly over the past year. His BMI is in the 95th percentile for his age. Mrs. Parker states that James drinks sugary beverages regularly and consumes large portions of food. How should you advise Mrs. Parker to address James's weight gain, and what are the potential long-term consequences if left unaddressed? Answer: James's situation indicates he is classified as obese with his BMI in the 95th percentile for his age. To address his weight gain, Mrs. Parker should be advised to make comprehensive lifestyle changes for the whole family. Dietary modifications are essential, focusing on a balanced diet that includes more fruits, vegetables, whole grains, and lean proteins. It is also crucial to limit sugary beverages and encourage smaller portion sizes. Encouraging physical activity is equally important. The CDC recommends that children engage in at least 60 minutes of moderate to vigorous activity daily. Behavioral changes, such as reducing screen time and increasing family activities, can foster healthier habits. If obesity is left unaddressed, James faces increased risks of developing serious health issues such as type 2 diabetes, hypertension, and cardiovascular diseases. Additionally, childhood obesity can lead to psychological issues, including low self-esteem and depression, which can impact academic performance and social interactions. Regular follow-ups to monitor his progress and make necessary adjustments will be vital for his long-term health. At what age should a typically developing child be expected to use two-word phrases, and what might be concerning if this milestone is not reached? Answer: typically, children should start using two-word phrases by 24 months of age, which reflects their developing language skills and cognitive growth. For instance, a child may say "more juice" or "go play," indicating they can combine words to express their thoughts and needs. If a child does not reach this milestone, it may signal a language delay or other developmental issues such as hearing impairments, cognitive delays, or even autism spectrum disorder. Early identification of such delays is crucial, as timely interventions can significantly improve outcomes. Pediatricians recommend regular developmental screenings during well-child visits, focusing on language and social-emotional milestones. If concerns arise, further evaluation with a speech-language pathologist may be warranted to assess the child's communication abilities and determine appropriate interventions. Identifying and addressing language delays early can help ensure that children develop effective communication skills necessary for social interaction and academic success. What are the primary nutritional concerns for a breastfed infant, and when should supplementation be considered? Answer: breastfed infants generally receive optimal nutrition from breast milk. However, specific nutrients may require supplementation to prevent deficiencies. One primary concern is vitamin D, as breast milk alone does not provide adequate levels of this nutrient, which is crucial for calcium absorption and bone health. To prevent rickets and other bone-related issues, the American Academy of Pediatrics recommends that exclusively breastfed infants receive a daily supplement of 400 IU of vitamin D starting from the first few days of life. Iron is another important consideration, and while infants are born with sufficient iron stores, these stores typically deplete by 4–6 months. Introducing iron-rich complementary foods, such as fortified cereals, or providing an iron supplement can help prevent iron deficiency anemia. Regular monitoring of growth and nutritional status during well-child visits is essential to ensure that any potential deficiencies are identified and addressed in a timely manner. Explain why the inactivated polio vaccine (IPV) is preferred over the oral polio vaccine (OPV) in the United States. Answer: the inactivated polio vaccine (IPV) is preferred over the oral polio vaccine (OPV) in the United States primarily due to safety concerns associated with OPV. While OPV contains a live, attenuated virus that can effectively stimulate immunity, there is a small risk of vaccine-derived poliovirus (EE), where the weakened virus can mutate and cause polio in unvaccinated individuals. This risk has led to the phased-out use of OPV in favor of IPV, which contains an inactivated virus that cannot cause disease. IPV is administered via injection and is highly effective in providing immunity against poliovirus without the associated risks of DPV. The Centers for Disease Control and Prevention (CDC) recommends a series of IPV doses for children, with the first dose given at 2 months of age, followed by subsequent doses at 4 months, 6, 18 months, and a booster at 4–6 years. The exclusive use of IPV in the U.S. has been instrumental in maintaining the country's polio-free status. What are the typical signs of precocious puberty in girls, and what is the most common cause? Answer: precocious puberty in girls is characterized by the onset of secondary sexual characteristics before the age of 8. Common signs include breast development, pubic and underarm hair growth, and the onset of menstruation. The most frequent cause of precocious puberty is central precocious puberty (CPP), resulting from early activation of the hypothalamic pituitary gonadal axis. While CPP is often idiopathic, it can also arise from underlying conditions such as brain tumors, infections, or congenital adrenal hyperplasia. The early onset of puberty can have significant psychological and physical effects on a child, including increased risk for emotional issues and early sexual maturation. Therefore, a thorough evaluation, including a detailed history and physical examination, is crucial. If CPP is diagnosed, treatment options may include gonadotropin-releasing hormone rate agonists to delay further development until a more appropriate age, ensuring the child can develop physically and emotionally in line with their peers. What are the key components of developmental surveillance during pediatric visits, and why is it essential? Answer: developmental surveillance is an ongoing process of monitoring a child's development during pediatric visits, focusing on various key components. These include obtaining parental concerns regarding development, reviewing the child's developmental history, and conducting a thorough physical examination to identify any potential delays or issues. Additionally, healthcare providers should utilize validated screening tools, such as the Ages and Stages Questionnaire (ASK) or the Modified Checklist for Autism in Toddlers (MCHAT), to assess the child's developmental milestones systematically. The importance of developmental surveillance lies in its ability to identify children who may be at risk for developmental delays early, allowing for timely interventions. The American Academy of Pediatrics recommends that developmental screenings occur while child visits, particularly at 9, 18, and 30 months, to catch any issues that could impact the child's learning, behavior, and overall well-being. Early identification and intervention can significantly improve outcomes and ensure that children receive the support they need to thrive. What are the potential causes of failure to thrive (FTT) in infants, and how should it be evaluated? Answer: failure to thrive (FTT) refers to an infant's inability to gain weight or grow at a normal rate and can be caused by several factors. Common causes include inadequate caloric intake due to feeding difficulties, neglect, or food insecurity. Other causes may include inadequate absorption of nutrients from conditions like celiac disease or cystic fibrosis, or increased metabolic demands due to chronic illnesses such as congenital heart disease or hypothyroidism. To evaluate FTT, a thorough history should be taken, including dietary intake, feeding practices, and any existing medical conditions. A comprehensive physical examination is essential to identify any signs of underlying health issues. Growth charts should be utilized to monitor weight and height over time, assessing whether the child is following a normal growth pattern. Laboratory tests may be indicated based on clinical suspicion to rule out metabolic, gastrointestinal, or endocrine disorders. An interdisciplinary approach involving dietitians and social services when necessary can help address the various factors contributing to FTT and develop a comprehensive care plan. Describe the potential health effects of childhood obesity and the importance of early intervention. Answer: childhood obesity poses significant health risks that can extend into adulthood, including type 2 diabetes, hypertension, and dyslipidemia. Obese children are more likely to develop metabolic syndrome, which encompasses a range of conditions leading to cardiovascular diseases. Additionally, obesity can affect a child's psychological well-being, leading to low self-esteem, depression, and social isolation due to bullying or discrimination. Early intervention is crucial in addressing childhood obesity, as it is easier to implement lifestyle changes in younger populations. Parents and caregivers should be encouraged to promote healthy eating habits and physical activity, aiming for at least 60 minutes of daily exercise. Schools can play a pivotal role by providing nutritious meals and incorporating physical activity into the curriculum. Regular monitoring of growth and BMI is essential, with healthcare providers offering guidance on healthy lifestyle changes and, when necessary, referring families to specialists for nutritional counseling or behavioral therapy. The goal is to create a supportive environment that fosters healthy habits and helps prevent the long-term consequences associated with childhood obesity. In pediatric care, under what circumstances can a healthcare provider proceed with medical treatment for a child without parental consent, and what legal principles govern this decision? Answer: informed consent is a foundational legal and ethical principle in pediatric medicine. It emphasizes the right of patients or their guardians to understand the nature of their treatment options, including potential risks and benefits, before giving consent. In pediatric care, this principle is complex due to the age and developmental stage of the child. When parents refuse consent for treatment, healthcare providers must evaluate whether the refusal is in the child's best interests. For instance, in emergencies where delaying treatment could result in significant harm or death, medical professionals may proceed without consent based on the principle of parens patriae, which allows the state to act as a guardian to protect a child. Furthermore, legal precedents and state laws vary significantly regarding the age at which minors can consent to their treatment. For example, many states allow minors to consent to reproductive health services or mental health treatment without parental involvement. Healthcare providers must stay informed about the relevant laws in their jurisdiction, ensuring they can navigate complex situations while upholding ethical standards and prioritizing the child's health and welfare. What are the key indicators of emotional abuse in a pediatric patient, and what is the healthcare provider's role in identifying and addressing such abuse? Answer: emotional abuse is a form of maltreatment that can profoundly affect a child's psychological and emotional development. Unlike physical abuse, which often leaves visible marks, emotional abuse may manifest through behavioral changes such as anxiety, depression, withdrawal, or aggression. Key indicators can include changes in a child's academic performance, social interactions, and overall demeanor. Healthcare providers should be vigilant for signs of emotional distress and the context surrounding a child's behavior during consultations. Recognition of emotional abuse requires a comprehensive understanding of a child's family dynamics and history. Indicators such as caregivers belittling, shaming, or threatening a child can signify emotional abuse. Healthcare professionals are mandated reporters, meaning they must report any suspicion of abuse to Child Protective Services (CPS). In these cases, documentation is crucial. Healthcare providers should thoroughly record observations, patient statements, and any patterns that may suggest emotional abuse. Mandatory reporting laws vary by jurisdiction, but generally protect individuals who report suspected abuse in good faith. These protections are essential to encourage reporting, ensuring that children receive the help they need while minimizing the risk of retaliation against the reporter. Ultimately, understanding the indicators of emotional abuse and adhering to legal obligations are critical components in safeguarding children's well-being and mental health. Mrs. Smith brings her 10-year-old son to the emergency room with signs of a severe bacterial infection. The physician recommends immediate administration of antibiotics, but Mrs. Smith refuses treatment, stating she prefers to use homeopathic remedies. What steps should the healthcare team take considering both ethical principles and legal obligations? Answer: in cases where a parent refuses necessary medical treatment for their child, healthcare providers must navigate a delicate balance between respecting parental autonomy and fulfilling their ethical obligation to act in the child's best interest. The ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm, come into play. In emergency scenarios where a child's life is at stake, the physician may intervene without parental consent based on the legal doctrine of parens patriae, which allows the state to protect those unable to protect themselves. When faced with a situation like Mrs. Smith's refusal of antibiotics for her son, the healthcare team should first engage in open and empathetic dialogue, educating Mrs. Smith about the severity of the infection. The implications of untreated conditions and the potential for rapid deterioration can help address her concerns regarding antibiotics. It may also be beneficial to explore her beliefs about homeopathic treatments. If the parent remains resolute in refusal, the healthcare provider may need to involve legal counsel or child protective services if the child's life is at risk. This action is not taken lightly, as it may lead to significant family upheaval, but the child's health is paramount. What is the role of anticipatory guidance in well-child visits, and how should it be tailored based on the child's developmental stage? Answer: well-child care visits are crucial for monitoring a child's growth, development, and overall health. Anticipatory guidance is an integral part of these visits, where healthcare providers offer tailored advice based on the child's developmental stage. This proactive approach aims to prevent potential health issues by educating parents about age-appropriate behaviors, safety measures, and developmental milestones. For infants, guidance typically includes information on breastfeeding, introducing solid foods, immunizations, and safe sleep practices to reduce the risk of sudden infant death syndrome (SIDS). As children grow, the focus shifts to promoting healthy lifestyle choices, such as nutrition, physical activity, and mental health awareness. During school-age visits, providers discuss topics like peer relationships, bullying, and academic performance. Healthcare providers also conduct essential screenings during well-child visits. Common assessments include hearing, vision, lead, and anemia screenings, which can identify potential health concerns early on. For adolescents, preventive care often encompasses discussions around risky behaviors, including substance use, sexual health, and mental health screenings for depression and anxiety. A 6-year-old child presents with bruises in various stages of healing, and the parent's explanation is inconsistent with the injuries. What steps must the healthcare provider take, and what legal protections are in place for those reporting suspected abuse? Answer: mandatory reporting laws require healthcare providers and certain professionals to report any suspicions of child abuse or neglect to appropriate authorities such as Child Protective Services (CPS). These laws are designed to protect children from harm by ensuring that suspected cases are investigated and addressed promptly. Healthcare professionals, including doctors, nurses, and therapists, play a critical role in identifying and reporting abuse due to their unique position in interacting with children and families. Indicators of physical abuse include unexplained injuries, frequent visits to healthcare providers, or inconsistent explanations from caregivers regarding a child's injuries. Emotional abuse might manifest through behavioral issues such as withdrawal or aggression. In the case of medical neglect, signs may include a child's failure to thrive or untreated medical conditions that cause significant harm. When reporting suspected abuse, healthcare providers must document their observations and any discussions with the child or caregiver, as detailed records support the investigation process. Mandatory reporting laws protect individuals who report in good faith, granting immunity from civil or criminal liability even if the report does not lead to a finding of abuse. At what age should children be screened for anemia, and what are the risk factors that indicate the need for more frequent screening? Answer: anemia screening is an essential component of preventive care in pediatric patients, particularly during well-child visits. The American Academy of Pediatrics recommends screening for anemia at around 12 months of age, as this is a critical time when dietary changes occur and the risk for iron deficiency increases. Early identification and management of anemia can significantly impact a child's growth, cognitive development, and overall health. Children who are at higher risk for anemia, such as those born prematurely, those with low birth weights, and those who experience inadequate dietary iron intake, should be screened more frequently. Symptoms of anemia may include fatigue, pallor, and irritability, which may prompt further evaluation by healthcare providers. The screening process typically involves a simple blood test to measure hemoglobin levels. If anemia is detected, healthcare providers should explore potential causes, including dietary insufficiency or chronic diseases. Treatment often involves iron supplementation and dietary modifications to increase iron intake, such as incorporating iron-rich foods like meat, beans, and fortified cereals. Mr. and Mrs. Johnson's 8-year-old daughter is terminally ill with a neurodegenerative disorder. The healthcare team suggests palliative care, but the parents insist on continuing aggressive treatments despite the child's deteriorating condition. How should the healthcare team proceed, considering ethical guidelines and the parents' wishes? Answer: navigating end-of-life care for pediatric patients involves sensitive discussions and ethical considerations, particularly when families struggle to make decisions about treatment options. In the scenario involving Mr. and Mrs. Johnson and their terminally ill daughter, healthcare providers must prioritize compassion while also advocating for the best interests of the child. Palliative care focuses on improving quality of life and alleviating suffering, emphasizing comfort rather than curative treatment. Healthcare professionals should initiate discussions about the goals of care, the expected trajectory of the illness, and the potential benefits and burdens of continuing aggressive treatments. This process often requires balancing the emotional needs of the family with clinical realities. Engaging in family meetings allows for open communication, enabling healthcare providers to explore the parents' beliefs and values while providing evidence-based information about the child's condition. The involvement of palliative care specialists can also facilitate these conversations, offering support and guidance to the family. What are the recommended practices for promoting good oral health in children, and when should fluoride supplementation be considered? Answer: promoting good oral health in children is a vital aspect of preventive pediatric care, as it significantly impacts overall health and development. Pediatricians should emphasize the importance of establishing oral hygiene habits early on, beginning with the eruption of the first tooth. Parents should be encouraged to clean their child's teeth using a soft brush and fluoride toothpaste, transitioning from a smear to a pea-sized amount as the child grows. Regular dental visits should be scheduled starting by age 1 or within 6 months of the first tooth eruption. These appointments help assess the child's oral health, identify potential issues such as cavities or alignment problems, and provide preventive treatments like fluoride varnish. Parents should also be educated about the connection between oral health and diet. Limiting sugary snacks and beverages can reduce the risk of dental caries. Encouraging a balanced diet rich in fruits, vegetables, and dairy products promotes strong teeth and gums. Healthcare providers can play a pivotal role in fostering partnerships with local dental professionals to ensure children receive comprehensive oral health care. Through anticipatory guidance and education about oral hygiene, diet, and the importance of routine dental visits, healthcare professionals can empower families to prioritize oral health, contributing to the child's overall well-being and development. Why is mental health screening important during adolescent preventive care visits, and which tools are commonly used to assess conditions like depression and anxiety? Answer: monitoring developmental milestones is crucial in pediatric care as it helps identify potential delays or disorders early on. Developmental milestones encompass various domains, including gross motor skills, fine motor skills, language development, social skills, and cognitive abilities. Healthcare providers should utilize standardized screening tools to assess a child's development during well-child visits. For example, by the end of the first year, most children can sit without support, babble, and exhibit attachment to caregivers. By age 2, milestones typically include walking independently, using simple words, and engaging in parallel play with peers. Pediatricians can use tools like the Ages and Stages questionnaires asked to systematically evaluate a child's progress across these domains. When delays are detected, healthcare providers should initiate early intervention services. These services can significantly improve developmental outcomes and quality of life for children. Engaging with parents and providing resources for developmental support is also essential. Educating caregivers about fostering their child's development through interactive play, reading, and social engagement can enhance growth in critical areas. How is medical neglect defined in pediatric care, and what are the legal responsibilities of the healthcare provider when this is suspected? Answer: breastfeeding is widely recognized as the optimal method of infant nutrition due to its numerous health benefits for both infants and mothers. The World Health Organization recommends exclusive breastfeeding for the first 6 months of life, followed by continued breastfeeding along with appropriate complementary foods up to 2 years or beyond. Breast milk is rich in essential nutrients, antibodies, and bioactive compounds that promote optimal growth and development. It supports the infant's immune system, reducing the risk of infections, allergies, and chronic conditions such as obesity and diabetes later in life. The composition of breast milk also adapts to meet the changing needs of the growing infant, making it a highly individualized source of nutrition. From a maternal perspective, breastfeeding can aid in postpartum recovery, promoting uterine contractions and reducing the risk of hemorrhage. It also supports maternal bonding and can lower the risk of certain cancers and chronic diseases. Healthcare providers should support breastfeeding by providing education and resources to mothers during prenatal visits and postpartum care. This includes offering information on proper latch techniques, recognizing feeding cues, and addressing common challenges like soreness or concerns about milk supply.